Hi, I'm Chris with the New Mexico Aging Services Department. I'm part of the State Health Insurance Assistance Program, or SHIP. And our program SHIP is here to help people navigate Medicare. We know that this time of year, especially during Medicare open enrollment, it gets very stressful for people. It's hard to know who to trust for accurate information. Your SHIP program is here just to support Medicare beneficiaries in making informed decisions. We don't sell or endorse any insurance. And we try to do our best to take the stress out of Medicare. So grab a cup of tea. My tea blend today includes chamomile, lemon balm, and lavender. There's no shame in being stressed out about Medicare. And we're going to walk through how to do a plan search so that you can navigate the many, many changes that are coming this year and make sure you have the plan that's going to work for you next year. So I'm going to share my screen and we're going to go to Medicare.gov and I'll show you how to get this resource that's available to everyone to work for you. The first thing you really want to pay attention to is making sure you're in the right spot. So there's a lot of copycats and people out there that are trying to get you to think that they're the source for Medicare information, but really the only place to go is straight to the horse's mouth at Medicare.gov. You know you're in the right place when you see the American flag in the upper left-hand corner that shows you that this is an official website of the United States government. So make sure you're in the right place. There's lots of places that are going to try to trick you into giving them your information. Basically, if anybody asks for anything to let you into the website, you want to walk away. So in the upper left-hand corner is where you're going to find the plans for 2025 that you'll need to look at for open enrollment. So I'm going to click right there on Find Plans. If you're just starting Medicare, you do not want to look at 2025 plans. So that's why there's a little button here that says first time joining Medicare. So you may want to look at that because if your birthday is in October, November, or December, you're going to want to actually sign up for a 2024 plan so that you don't have a gap in coverage. So assuming that we're all already on Medicare, we're going to scroll down here and you have two choices. You can log in using your Medicare.gov account, which I actually think is a great idea. It's a big time saver because if you already have an account on Medicare.gov, you don't have to enter all of your medications in again. And it's already going to come preloaded with the information about your current plan and coverage. So it can be really, really helpful. You may want to consider making an account if you don't have one already. Today, for our demonstration purposes, we're going to go ahead and continue without logging in. And if you're worried about having any information on the computer, you're not alone, and you can get the information you need without creating an account. So we're looking at 2025 plans, and I am going to put in the zip code for Lee County. I'm going to put in 88267 just for fun because I like to travel all over the state. And we'll see what we get. We're going to look at Medicare prescription drug plans. You can do a plan search for a Medicare Advantage plan or a prescription drug plan. Here in New Mexico, we don't have an open enrollment period for Medigap plans, so don't click this one. And the next thing we see is questions about whether or not you get any help with your Medicare costs. So if you have the Medicaid home and community-based waiver and you have a caregiver, you might click this button. If you get SSI, supplemental security income, you'd click the second one. If you're just collecting regular Social Security retirement, you don't click this. If you have a Medicare savings program that helps with your premiums and copays like QMB or SlimB, you would click this button. And if you get extra help from Social Security, you'd click extra help. Sorry, that was not hard to figure out. So for our demonstration purposes today, I'm just going to click that we don't get help from any of these programs. But what you see could change depending on if you click one of these buttons. All right, so the next thing is, do you want to see drug costs when you compare plans? Please always check left. Yes, the only time you're going to say no is if you actually don't take any medications. You want to know how much your drugs are going to cost. This year, there is a cap, a $2,000 cap on out-of-pocket costs for prescription drugs, which is a great thing for people. You don't have to do anything to qualify for this. Everyone who gets Medicare has the same cap. However, the drug companies have really made some substantial changes to their formularies. And so you can't assume that the medications that were covered just fine last year are going to be covered the same way this year. So it's really important to pay attention to the letters, anything that you get in the mail from your plan, and also to double check for yourself to make sure that your plan is going to cover your drugs the way you expect it to. So we are going to put our drugs in here. And when you type your drugs in, I'm just going to put in a few common and maybe a few not so common ones. You start typing and then a drop-down menu appears. You have to click on the drug name in the drop-down menu. You can't just type it in. So I'm going to click on Ozempic down here, and I'm going to click Add Drug. Because it's just for demonstration purposes today, I'm not going to put in specific dosage and quantity information, but you will do that. You'll make sure that this actually reflects what your prescription is when you put your drugs into Medicare.gov. All right, let's do another one. I'm going to do Ubrelvy. I don't know where they come up with these names. It's crazy. Okay, I'm going to add that one to the list. Add another drug. Everyone's favorite, Xarelto. So here it is. I have to click on it. I can't just hit return. And we'll put that one in there. You can see why it might be nice to have an account because this takes a minute. Let's put in Jardiance, really common diabetes drug. Okay. Another one, Losartan. Oops. Okay, here's really important. So you can see that there are lots of different varieties here. Do we need Losartan potassium? Do we need hydrochlorothiazide and Losartan? Is it Valsartan? So it is extremely important to know the exact name of your medication because there are variations and they're not all the same. And what you put in is it's garbage in, garbage out. If you don't put in the right information, then you may be making decisions based on inaccurate information. So this one is Losartan potassium. Let's add that. And last but not least, we're going to put in Lipitor. Okay. And on this one, a little window pops up that says your drug has a generic. You may very well see this when you do your own plan search. You can add the generic, but if you know that you can't tolerate the generic, then you can also check keep brand. So we're going to put in the generic this time. Add it to the drug list. Okay, so that's all the medications we're going to put in for now. I'm going to click Done Adding Drugs. The next thing is pharmacies. I strongly recommend that people put in as many pharmacies as possible. This isn't a commitment to where you're going to pick up your drugs, but it shows you the difference in the cost depending on where you pick them up. There can be huge differences. So I'm going to scroll down here and we can see that mail order is already checked. Even if you think you don't want to get your drugs through the mail, I highly recommend just taking a look at how that impacts your costs. So I'm going to leave that one checked. Let's see. I'm going to check check the Knoll Pharmacy, Michael's Prescription Centers. There's only 3 available in this area, so I'm going to check all of them. And done. And I'm going to just, while it's loading, have a little sip of tea. Okay. So here we are. It's showing us 10 of its, we've got 15 drug plans available in the area. You can see down here, it says it's showing 10 of 15 drug plans. So we're looking at plan type. You can switch if you're like, maybe I do want to look at those Medicare Advantage plans that I'm seeing all over the TV right now. You can click right here and it'll switch you right over and you don't have to enter your drugs again. We're not going to do that today, but you can. You can also look up just by the drug companies. So in this particular area of New Mexico, there's only 6 companies that offer drug plans. So you're gonna get one of these. They're sorted by lowest drug and premium cost. I recommend leaving it like that. You can also sort by deductible and lowest monthly premium, but lowest monthly premium does not always translate into lowest costs over the course of the year. So I like to look at it all together like this. So the first one that comes up for us is a Humana Premier RX plan, prescription drug plan. PDP stands for prescription drug plan. And it says over here, 2 of 3 of your selected retail pharmacies are in network. We're going to see what that means for our costs when we dig in a little bit. We can see just on this summary page that it has a $77 a month premium. That's what you're going to pay every month just to have this coverage. And if you go through mail order, you'd save a tiny little bit of money, $15, but it's going to be about with the medications we put in, you can expect the cost of your premium and medications over the entire year to be about $1,300. This plan has a 0 deductible. So let's look at the full details and see how that all breaks out. You can enroll in a plan once you've thoroughly reviewed and decided on what you want by clicking the green enroll button. You can also call the plan if you have questions by using one of these 800 numbers at the top. Okay. So a lot of your costs on this are going to come from the premium. You've got a $77 a month premium, and your drugs are going to cost a total of either $390 or $375. That's going to be your out-of-pocket copays. And let's look at how that breaks down. So here's that summary again with the monthly premium, the drug deductible. Okay. Anytime there's something with an underline, you can click on it to get more information. In this case, it takes you to the extra help information. And how do I get back from there? Okey-doke. So you can go and get more information. They try to make it easy for you to find what you need to have the best information to make a good choice for yourself for the coming year. If you decide you want to look at some other drugs, like maybe you put something in and you're like, well, I don't really take that anymore. I just wanted to see. You can click on this change drugs button and it'll take that off. Or if you want to put something else on, you can do it from here also. So we can see that it starts with your drug list, right? And there's all the drugs that we put in. The next is your pharmacies. So you could change pharmacies from here. There's a big banner. They're required to educate you about how changing pharmacies can actually impact your costs. So it looks like the hospital down in Lee County is out of network. So you wouldn't want to get your drugs there. But Michael's, Knoll, and mail order are all in network. So let's see what that means. Holy cow. $7 if you get your atorvastatin at one of the in-town pharmacies, zero copay if you get it from mail order, and $2,000 if you get it from the out-of-network pharmacy. So you can see you do not want to be selecting an out-of-network pharmacy. If you know there's a particular pharmacy that you want to use, like some people have a long-standing relationship with their pharmacist, then you can sort by looking at only plans where that pharmacy is in network. All right, so here we can see the costs just in general. This one, there's some information here about the new Medicare prescription payment plan. So for people who have a medication with a high copay that's difficult to pay all at once, the Medicare prescription payment plan may be a good idea for you. It does not lower the cost. What it does is it spreads it out over the course of the year. So say in January, you were taking a medication that had a $200 copay. If you signed up for the prescription payment plan, that would spread that copay out over the whole rest of the year. It would sort of prorate it month by month, which can, even though it doesn't reduce your overall cost, it can make each month a little bit more affordable. This is not something that you can sign up for in advance. This is something that when you go to the pharmacy to get that medication with the high copay, your pharmacist should tell you about if you think it's a good idea for you, or you'll also get some information from your plan. If you have questions about it, you can always call us at the Aging and Disability Resource Center at 1-800-432-2080, and we'll see what we can do to help you with it. Okay, so the next section shows you the total cost, your total copays, drug and premium cost, if you pick up your medications at each of these pharmacies. And then it breaks it down by month, right? So we're not even going to look at the hospital because that's obviously too expensive for anybody. And you can see that you've got $195 in copays with a particular mix of medications that we put in January and February. That works out to about $400, right? And mail order, you have one copay. It's a 3-month copay of $375. So it's a little bit less, but it's all at once. You may want to be on a prescription a payment plan to spread that cost out over the year so that you don't have to spend, pay it all at once in January. And then for the rest of the year, you have zero copays because of that $2,000 cap. And there's more about that information, more information about that right down here. So basically, anytime you see a plus, you can open that up and get more information. So we can see that. We can see the retail cost of each medication. We can see the cost after the deductible is met, and we can see the cost after the out-of-pocket cap, which is all going to be a lovely zero. There is no more donut hole. The donut hole has been fully eliminated for 2025. So you can see that the atorvastatin, cheap, $3.80 before or after deductible. Jardiance, a little bit more expensive, but you're not paying most of that. So its retail cost is $590. But once your deductible is met, and I think the deductible on this plan was zero, so it's already met, it's $47, which seems like a lot, but it's a lot less than $590. There's your losartan, which is cheap. Ooh, Ozempic, also really expensive retail cost, but you're only having a $47 copay. And Ubrelvy, man, if you take this, you want to make sure it's on your formulary because that's going to hurt. That $2,000 cap only applies to medications that are on your plan's formulary. So if we were looking at a plan where one of your expensive medications wasn't on the formulary, there is no cap. You continue to have to pay that out of pocket. So it's super important to double check that if you're taking Xarelto or any more expensive medication. So this shows you how the costs break out depending on where you get it. And you can see that there are big differences in retail costs, right? So on this one, if at Michael's, the atorvastatin retail cost was $3.80. With a mail order, it's $541, right? And that depends on the agreements each of these pharmacies has with who they're buying the drugs from, right? The retail cost is $500 and it doesn't cost you anything. I mean, it's really interesting. I don't pretend to understand the economics of how this all works. So if you want to know more, you would click on this plus sign here, and it will tell you the information about your drug tiers, your preferred, generic, specialty tier. It'll show you whether there are quantity limits, whether step therapy is required, prior authorization. This is where you get all of that information. So I'm going to go back to the top by clicking overview. That way I don't have to scroll back through the whole thing. And this, it looks like a pretty decent plan, even though it has a relatively high monthly premium. I just want to show you, look at the difference here. So this one has a $77 monthly premium. So you're paying for this plan, but you have your drug out-of-pocket costs are really limited. You're only going to be paying a few $100s for your actual drugs. This plan has a very low monthly premium, 20 cents, but you're going to pay over $2,000 for your drugs. And what this means is you're not paying a monthly premium that's not getting taken out of your Social Security check or however you choose to pay that. But when you go to the pharmacy to pick up your drugs, you're going to have copays. And this one has a $590 deductible. So it's not always in your best interest to just look at the monthly premium because there are a lot of other things that impact your costs. So let's just take a peek here and see why it costs so much. Okay. Well, you're going to be paying out of pocket $2,000 for your drugs if you have this plan. You got that $590 deductible. And let's just look at how this breaks out. I'm going to scroll down here. We can see that just like with the other plan, Michael's, Knowles, and mail order are all in network, but the hospital is out of network. And it looks like, youch, you got really big copays in the first month because you've got that $590 deductible. Okay. So with this plan, you would definitely want to do a prescription payment plan to spread these costs out over the year, but you'd probably want to keep looking to find a better plan. So what happens here is we've got the cost before the deductible, the cost after the deductible, and then cost after you've hit that $2,000 maximum cap. So it's really, really important to look at the details of the plan so that you make sure all your drugs are on the formulary. The costs are spread out in a way that is affordable for you and that you know what you're getting and it's what you expect. We are conducting, our SHIP counselors are going to be around the state from now until December 7th, doing in-person events to help people take a look at their plans and look at their options. You can go to our website to find the calendar of events. You can also call the Aging and Disability Resource Center at 1-800-432-2080. They can let you know if there are events coming up in your area, and they can also make an appointment for you, a phone appointment, to talk to one of our SHIP counselors if you want a little expert support sorting through your options and all of the changes that are coming up for 2025. We're more than happy to help because reducing your stress around Medicare is why we're here. Thank you so much.